my deep appreciation to the Transatlantic Leadership Forum and the French founders for the opportunity to join you today to speak about the mission of the Institut Curie, France's leading cancer research and care institution. My appreciation to everyone here for your dedicated work and contributions in fueling the French-American connection. This gathering is testament to the powerful, enduring Franco-American alliance. Mon amis, consider this. All of us in this room have at least two things in common. First, our love of France. We all treasure the friendship and strong bonds between the United States and France in confronting major global challenges, as well as, importantly, advancing economic opportunity, innovation, and health. And this brings me to the second thing that we all have in common. Cancer has touched our lives, a disease that affects 1 in 3 people in the United States and in France. Joined by terrific members of the Curie team in Paris, we are here to tell you about the life-saving work of Institut Curie, a place where research, medicine's field of dreams, is producing revolutionary findings about the causes of cancer and a new era of breakthrough treatment and prevention strategies. It's a place where state-of-the-art, cutting-edge care is provided to patients, rapidly translating research advances from the laboratory bench to the clinical bedside, to benefit people's health in France, in America, and worldwide. The Institute carries forward the legacy of Madame Marie Curie, perhaps the most iconic scientist in history. So let me begin our story by sharing a video introducing you to Institut Curie's groundbreaking work.
Back in 1920, the world-famous Marie Curie had already won 2 Nobel Prizes. One for developing the theory of radioactivity, a term she coined, and the second for her discovery of polonium and radium, using techniques she invented for isolating radioactive isotopes. However, despite her fame, she could not afford the gram of radium she needed to continue her groundbreaking research. Realizing how important Marie's research was for the world, American journalist Mary Maloney launched a fundraising campaign, and American donors responded, raising an amazing $100,000 back in 1921. And Marie Curie got her gram of radium. For this act of kindness, we are forever grateful. American generosity was pivotal in helping Marie Curie and her growing team of both scientists and physicians perform life-saving research that revolutionized cancer care around the world, including the development of radiation therapy and imaging diagnosis, techniques that remain widely used to control cancer to this day. Since 1921, Institut Curie and America have worked collaboratively on many levels, from funding research to the sharing of information and pioneering innovations. One example is the powerful developments in radiation therapy at the Memorial Sloan Kettering in New York by former students of Marie Curie. One of Institut Curie's leading principles is that of openness, tapping into the power of collective thinking in the fight against cancer by bringing together the best scientists, researchers, and medical teams from around the world. Although we know more than ever about cancer, it's still not enough to win the war. Institut Curie approach is a program to apply the most recent developments in chemical biology to take up an essential challenge in clinical oncology, circumvent the adaptation mechanisms of cancer cells. For this, the creation of a new chemical biology research center is essential, giving France a unique facility to focus on aggressive tumor types, such as triple-negative breast cancers, pancreatic cancers, and many more. Chemical biology is our new gram of radium, and we need to call on the generosity of our American friends again to help us build the new Chemical Biology Research Center to keep Marie Curie's ambition alive for the next 100 years. Now, With over 3,400 staff members, Institut Curie scientists are making groundbreaking discoveries in chemical biology, paving the way for new promising treatments that will act faster and provide longer-lasting relief for patients around the world. This challenge is much bigger than Marie Curie, France, or even the United States. It is a once-in-a-century opportunity to shape the next generation of leading cancer treatments, saving the lives of patients all over the world. With the latest research showing that 1 in 2 people will develop cancer in their lifetime, it is time to make the future safe for our children and our children's children. Be part of the future.
So that's the Institut Curie's mission. I now want to tell you why the Institut Curie is so important to me, why it is my honor to serve as the Institute's ambassador in America, and why I hope the work of the Institute will be of interest to all of you. You see, when I was 10 years old, my mother developed thyroid cancer. And I'll never forget visiting her hospital room. On it was a large skull and crossbones with the menacing words, radioactive. You see, she'd been given radioactive iodine to treat her cancer, and she'd become too hot to handle, too hot to give a child's kiss. What did radioactive mean? I asked her doctor. He told me about an amazing woman scientist, Marie Curie, who had coined the term radioactivity and had won 2 Nobel Prizes for her work that paved the way for the kind of life-saving treatment my mother was receiving. The doctor explained that Marie Curie had experienced discrimination and prejudice in her career, but her passion, her perseverance, and her purpose had propelled her forward. My mother's illness and Marie Curie's career motivated me to become a doctor at age 10. But then in my first year of college, my mother developed breast cancer, and in my last year of medical school, the disease metastasized to her spine, so that this beautiful, brilliant woman could no longer walk. She fought the disease with great courage and dignity, and she lived long enough to see her daughter become a doctor. I vowed then and there that no other woman should have to suffer the way she did. And that's why I dedicated my career as a physician to improving women's health, including the battle against cancer, first as Assistant Surgeon General of the United States, and then as America's first Deputy Assistant Secretary for Women's Health. Thankfully, when it comes to fighting cancer, much has changed since my mother had the disease. The stigma surrounding cancer has been shattered. When I was growing up, you couldn't say the word cancer out loud. Knowledge has been expanded, survival rates have significantly risen in both America and France, and as a result, we now have an entire generation of women and men who are cancer survivors. Well, what role did the scientific trailblazer Marie Curie play in this progress, and what was the French-American connection that supported her work? Well, as you heard in the video, Curie was a pioneer in the new field of radiation oncology. Her 1903 Nobel Prize was the first awarded to a woman. She remains the only woman to win this honor twice, and the only person to win it in 2 scientific fields, physics and chemistry. In 1920, after being awarded the 2 Nobels, Marie Curie was interviewed in Paris, as you saw in the film, by a prominent woman journalist, Marie Maloney. At the conclusion of their discussion, she asked Curie, "What is it that you're looking for?" Curie said, "A gram of radium." Inspired by her revolutionary work, Marie Maloney organized a successful fundraising campaign, the equivalent of $1.2 million today, with the help of an American committee. In 1921, on her first ever trip to America from France, this gift of radium was presented to her at the White House by President Harding. And 8 years later, through additional funds raised by Americans, Curie received another gram of radium for her work, presented to her by President Hoover at the White House. And Marie Curie used these gifts to develop the field of radiation oncology. While significant scientific collaborations on cancer continued between France and America since Curie's visit to the United States, for more than a century, the special relationship between the Institut Curie and America was dormant. until 12 years ago when the Institute asked if I would help organize a 21st century American committee to support its work. In 2021, commemorating the centennial of Curie's visit to America, it was my honor to welcome Curie's and Marie Maloney's descendants at the French Embassy in Washington, D.C., where a conference on advances in cancer was convened, and to lead an initiative in the United States that raises support for the Institute that carries forward this iconic woman's scientist legacy in the 21st century. Friends, for me, this is paying it forward. As an American, helping promote the work of Institut Curie, France's leading cancer institution that saves people's lives like my mother's life was saved by Marie Curie's radiation oncology discoveries. Today, while cancer remains a leading cause of death worldwide, the good news is that we have learned a great deal about this disease from research, and people are being cured. As Ben Franklin, America's first ambassador to France, once said, "An investment in research pays the greatest dividends." And I believe we're on the brink of a whole new era to detect cancer using 21st century technology tools like artificial intelligence that previous generations could only have dreamed of. And that is what the work of the Institut Curie is all about. Since 90% of cancer deaths are linked to metastasis, it's what caused my mother's death, the Institut Curie, as you heard, is building a new chemical biology research center, the first of its kind in the world, that will host interdisciplinary teams of scientists from countries around the globe who will conduct innovative research to increase knowledge about the mechanisms of metastasis and, importantly, develop novel medications to stop it from happening. As we look to the future, let us remember the words of Marie Curie. "I never see what has been done. I only see what remains to be done." Reflecting on her legacy, its impact on cancer research and care, and on inspiring generations of female and male researchers who follow in Curie's footsteps, while significant progress has been made, much more remains to be done. And that is what the Institut Curie's mission and the vital scientific partnership between France and America is all about: saving lives, ensuring a healthier future for us all, and bringing us to the day when children will have to look to the history books to learn there ever was a disease called cancer. Thank you so much.
So good morning to all of you, and thank you for the introduction, and thank you for the fantastic opportunity to be here this morning. So to give you an overview of what we are doing in Institut Curie for a world without incurable cancers, because we think that this is not only a dream, this is something that we can achieve within the next few years. And so with this, we are really happy to present this work. So we as scientists, and all of you know that cancer remains one of the leading causes of death in Western countries. And in fact, as scientists, we have to face what I like to call a yin-yang challenge in cancer care, which means that at the same time, cancer, all of you know that it's not one disease, but hundreds, thousands of different diseases, and that we need accurate and personalized medicine to be able to really decipher between all of these different diseases from a clinical and biological point of view. But at the same time, we also need to understand common mechanisms that are really, I would say, universal to all types of cancer. And such mechanisms, for example, the way how cells acquire the capacity to metastasize or to resist to treatments are really universal. And this is only by combining both personalized medicine and also understanding universal biology of cancer that we will be able to find a way to cure cancer. And so to illustrate this, I would like to tell you about a true story. This is the story of a patient who was referred to me in 2018. I'm a medical oncologist, so I treat patients with mostly metastatic cancer. And so this young boy, 32-year-old male, was referred to me. You can see his PET scan on the right of the screen, and basically everywhere it's black, it's cancer cells. So you can see that there are lots of metastases in his body. And so he had lymph node and diffuse bone metastasis. And he was referred to me to find the origin of those metastases because, in fact, on the PET CT, we could not find the primary tumor that gave rise to these metastases. And so he underwent a biopsy because this is the way we diagnose cancer. You had to take a small piece of tumor and to analyze it to be able to know what type of cancer it is. And this is the pathological report that you can read here. So undifferentiated carcinoma, which means cancer cells, compatible with kidney, pancreas, or lung origins, among others. And so when you're a medical oncologist and that you have this kind of pathological, you say, thank you, I don't know how to treat my patients. And in fact, this is a specific entity that we call cancer of unknown primary, which means that it represents approximately 1% to 2% of all cancers, so it's not so rare. And these cancers are defined by metastasis in the body, but we cannot find the origin of these metastases. And this is really a challenge for medical oncologists because, as all of you know, the main way to treat patients is to find the origin of metastasis, and you're not going to give the same drugs to a patient with metastasis of breast or kidney or colorectal origin. So those patients are treated with empiric chemotherapy, which means that we use drugs that can be effective on many, many different types of cancer, but as you can see, it doesn't work really well because the median overall survival is less than 8 months, so this is really a devastating disease. And so, in fact, in 2019, we made the hypothesis that these metastases in patients with cancer of unknown primary had to keep some specific biological features of their primary tumor. And if we as physicians could not be able to detect this primary tumor, maybe an AI algorithm trained to really recognize all types of cancer would be able to find really the origin of these metastases and to identify finally where those metastases come from. This was really the main hypothesis, and we didn't know at all if it was true, if it was going to work or not. And in fact, we took benefit of many, many public profiles, biological profiles. I would say it's like, ID, molecular ID of cancers that are available and have mostly been really generated by the US government in the early in 2020. And so more than 20,000 cancer and normal tissue, we use those ideas to train a specific tool that we call transcriptomic. And we tried to see if this tool was able to really recognize all those cancers. And what you can see here is the representation of those 20,000 biological IDs of different cancers. And each dot is a specific tumor. And you can see that all those tumors are not spread randomly on this map, but forms clusters. And in fact, each cluster is a specific cancer subtype, which means that AI is able, by itself, to be able to recognize all those subtypes of cancer without being, I would say, trained by us, but it was able to really recognize all those cancer subtypes. And so the next step was to test this tool on patients with cancer of unknown primary. And this is what we did. And each red dot is the sample of one patient. And what you can see is that each red dot comes into a single cluster, specific cluster, which means that in approximately 80% of patients that we tested, the tool was able to find the origin of these metastases. And it can look like just a tool, but in fact, it was really useful in the clinics. And for patients, the tool gives us the diagnosis of kidney carcinoma with a confidence of more than 99%. And this patient was a true patient. He was patient 0 that we included in this I would say, test. And so we decided to treat this patient with a treatment that was really tailored according to the kidney origin. We don't use at all chemotherapy for kidney cancer. It doesn't work at all. So we use immunotherapy and anti-angiogenics. and he showed complete response and has been cancer-free for more than 3 years. So this was really, I would say, an illustration of how AI can help solve a clinical problem, a clinical issue. And so really fast, we decided to transfer this tool in clinical use in France, first in Institut Curie, and then at the national level for all patients with cancer of unknown primary. And just to show you on the approximately 200 first patients that we analyzed, you can see that on the left, it's the diagnosis that was suspected before AI, and on the right, it's the final diagnosis given by AI. And in more than 70% of cases, the diagnosis was completely changed. And so it shows how AI can change our practice, but most importantly, what I want to show you is survival data. So I don't like to say survival curves because this is always difficult to see this kind of curves. Basically, you can see that when the time is on the x-axis and the proportion of patients alive is on the y-axis. And you can see that the curve drops and it shows that patients die, okay? But what you can see is that the purple curve is the curve of the survival of patients that were treated according to the diagnosis given by AI. And you can see that we had an 18-month survival compared to 11-month survival in patients that were not treated according to AI. So we managed really to increase the survival of patients with just a tool that helps us solve a clinical question. Though this curve is nice, but it shows how AI can help us in the first yin of the yin-yang challenge. I would say precise and personalized diagnosis or treatment, you can manage to increase the survival of patients. But what do we want? We want a curve where everybody is alive, okay, 100% of patients alive. And for this, we need to really understand the biology of metastasis, because as I told you, cancer of the non-primary is a disease where patients have diffuse metastasis, and so we use chemotherapy. It helps increase the lifespan, but it doesn't cure. And to cure patients, we need to understand how cells can become metastatic. And what has been shown in Institut Curie by the team of Dr. Rafael Rodriguez, who is with us this morning, who is research director in Institut Curie and has really created this chemical biology program, is that to become metastatic or refractory to treatments, cells really need to change the way they use metals, and especially irons. And this has been really the subject of two major publications in Nature, which is, I would say, the Bible for researchers that were those last years. And most importantly, his team and he have designed specific drugs that can block cells in the way they acquire properties to become metastatic. So with this, I would like to thank all the people with which I would say I work every day. I would like to thank you for your support, and we need you for this chemical biology of cancer program. So we would be really happy to discuss future opportunities, and please help us to fight against cancer. Thank you.